Hi there, this is Kurt Kasanowski from Hospice Advisors. How are you? Back to our weekly case study. This case study deals with developing a committed medical staff. And this situation takes place with a hospice in New Mexico, but I've worked with many hospices across the country and home care companies where they just don't have a really committed medical staff. In this specific case, the presenting issue was the leadership of this hospice basically hired doctors to basically just generate business for them, referrals, which was taking a very, very narrow-minded and funneled vision approach of looking at all the other opportunities that are out there to engage a medical staff. And their census has sort of hit a wall, and as we did a diagnostic on their growth factors, the physician component really popped out as being one that could be enhanced tremendously. So that's the situation. That was a presenting issue. What the plan was is we sat down and we did a little strategic planning session with the leadership team, really looking at what do we want to engage our physicians for. One, it was for quality, enhancing quality, improving service, meeting regulatory and compliance standards by CMS, and also helping with growth. So instead of just looking at growth solely for itself, we wanted to expand and get a balanced approach for what we were looking for with a physician. Then we also sat back and reevaluated the criterion for how we would go after those physicians. So it wasn't just strictly on how large their practice was, et cetera, et cetera. That was important, but wasn't the sole factor. Their reputation in the community, what type of physician they were, did they have any working knowledge of hospice and palliative care, et cetera. So those are some things that we did. Then we also came up with sort of a working motto, if you will. If it's not illegal, not immoral, and not unethical, the more business relationships you have with physicians, the better. So let me repeat that. If it's not illegal, not immoral, and not unethical, having a large cadre of physicians in a business relationship helps accomplish those quality, cost, compliance, and access issues for your hospice. So this hospice went about identifying a prime medical director that did most of its interdisciplinary team meetings. They hired several physicians to do face-to-face visits for people in the community, and we really ramped up our physician interaction with a certain segment of physicians. We hired two hospitalists groups, and we had two hospitals we were focusing on developing GIP programming, and hired two hospitalists to be our physicians, and we developed a contract with them to see our patients that were in those facilities. Then we also, from a consulting perspective, brought on a cardiologist, and that cardiologist was really helping us work with and develop a cardiology program for hospice and palliative care. So they really engaged a nice mix of physicians for a number of different reasons. The other thing that the group committed to, the leadership group, was one is the executive director would have dinner with these cadre of physicians at least 3 times a year to sort of sit down, use the opportunity to interact, hear what was going on with the business, do some education, and further develop the relationship with the physician. Second, we engaged and implied one of our marketing people to go out and build that specific physician as his or her account and develop the relationship so they felt, they being the physicians, more connected to the hospice. We also did an annual education event. It was a day and a half at a very, very nice resort where we brought the physicians in, asked them to invite their wife's significant others. And Friday we had a full day of education. We brought in a really expert panel of physicians and people to help talk and work with our doctors. We did an evening event where it was dinner, socialization, camaraderie, very, very excellent for building team. And then Saturday, we did a half-day Saturday in terms of looking at the education, and then the event was over. So with that, I ask you, one, what is your strategy, and how happy are you or not happy are you with your medical development efforts? 2 is, how are you utilizing your physicians? And then 3, what are some things that you can do so you can enhance your commitment to your physicians and improve quality, access, service, and regulatory compliance issues? So with that, I'll say happy holidays and take care. Bye-bye.